Assalamualaikum, salam sejahtera and good day. Today's session is on leg muscle, muscles around the leg region. Okay, the objective is to identify the origin, the insertion and function of leg muscle. The muscles around the leg basically move the ankle joint and the digits in the foot. Okay, basically it moves the ankle joint and the digits in the foot. Right. The leg muscles are grouped into anterior compartment, lateral compartment, and posterior compartment. If you still remember the muscles in the thigh, we grouped it into anterior, medial, and posterior. But it is slightly different for leg muscle. It has anterior compartment, posterior compartment, and lateral compartment. So that's why it explains why we can actually palpate the medial part of our tibial bone. Okay, we can palpate our shin. Kita panggil dalam laymannya shin. Okay, shin is actually the medial border of our tibial bone, right? Why we can palpate it? Because basically at the medial compartment of the leg there is no muscles. Okay, there is no muscle and it is almost bare. Maknanya tidak ditutupi. Okay, bahagian medial tibia itu tidak ditutupi oleh otot. Alright. Sebagai satu pengenalan, the leg muscles ni setiap kompartmennya saya berikan fungsi-fungsi secara general ya. The anterior compartment of the leg, the general function is to dorsiflex. Okay, dorsiflex. This is the foot, so you dorsiflex, and also to extend the digits. Okay, extend the digits in the foot. The lateral compartments, okay, the lateral compartments on the fibula side basically is to evert, okay, eversion. Eversion is to bring the medial border of our foot like this, okay, interiorly. And then the posterior compartment of the leg, basically the general function is to do plantar flexion, and also digits flexion of the foot. Okay, now let's see one by one. What are the muscles in each of the compartment? Right, in the anterior compartment first, right? Anterior compartment of the leg, we have four muscles, okay? Four muscles. They are the tibialis anterior muscle, extensor hallucis longus muscle, extensor hallucis longus muscle, extensor digitorum longus muscle, extensor digitorum longus muscle, and the deepest muscle in the anterior compartment of the leg is fibularis tertius muscle. Fibularis tertius muscle. Okay. On the right hand side here, okay, the diagram has already laid out for you the bone, the tibia and fibula, and the origin of these four muscles. Okay, this is what you should do in learning muscles origin and insertion. You draw the skeleton, and then you colored the area where the muscles originates and also where the muscle inserts. Okay, so for example, in this one, in this drawing, in this diagram, it has already illustrated for you the location of origin of the tibialis anterior, which is at the lateral border of the tibia. Okay, lateral surface of the tibia. Okay, near the interosseous border. Okay, near the interosseous border. And then you can see clearly from here there is the origin of insertion of extensor hallucis longus muscle and extensor digitorum longus muscle. Extensor digitorum longus muscle occupies the medial side near the interosseous border of fibula, and while the extensor hallucis longus muscle originates from the interosseous membrane of tibiofibular joint. Okay, and then there is the fibularis tertius origin. Okay, fibularis tertius origin. All of these muscles, okay, will produce dorsiflexion at the ankle joint. Dorsiflexion at the ankle joint. All right. And on top of that, the extensor hallucis and extensor digitorum will extend the digits. Hallucis will extend the first digit in the foot, while digitorum, extensor digitorum longus will extend the digits, the second to fifth digits of the foot. All right. And the fibularis tertius has an extra movement that it can do, that is to do eversion. Okay, eversion. Right. Now let's take a look at the lateral compartment. Lateral compartment of the leg. In the lateral compartment, because the lateral, if we look at this, yeah, we look at the position of the tibia and fibula, we will see that the fibula is actually on the lateral side. Therefore, the lateral compartment of the leg is basically occupied by the muscles named with fibularis. Okay, taken the name of fibula bone. Okay, fibula bone. So there are two muscles here in the lateral compartment of the leg. They are the fibularis longus and also fibularis brevis. Okay, fibularis longus and fibularis brevis. The fibularis longus will the fibularis longus originate from the head of fibula, and will the tendon of the fibularis longus will wind around underneath the sole of the foot, ya, dekat bawah dia pusing from daripada tepi, dia pusing ke bawah ke tapak kaki, and it inserts at the first digit, the base of first metacarpal. The base of first metatarsal, not metacarpal, sorry. The base of first metatarsal and also medial cuneiform. Okay. Bila dia wind around macam tu, so bila dia contract, dia akan buat apa? Dia akan buat eversion. Okay, dia akan buat eversion, right? So this one, this tendon, when they pull, when they contract, they pull, dia akan pull together the first digit to medially, like that. Okay. Now the fibularis brevis fibula, dia akan insert dekat the fifth metatarsal, the base of the fifth metatarsal. So when they pull, okay, when it pulls, the brevis pulls, it will cause inversion. Inversion like that. Okay. All right. Now look at the posterior compartment. The posterior compartment has the largest number of muscles in the leg. Okay? The posterior compartment has the largest number of muscles in the leg, and they are grouped into superficial group and also deep group. Okay, superficial group and also deep group. Okay, basically the superficial group are the palpable muscle. Okay, are the palpable muscle, and their major function is to do plantar flexion. Plantar flexion. Okay, what are the muscles in the superficial group? From superficial to deep, they are the gastrocnemius muscle. The gastrocnemius muscle. This gastrocnemius muscle is palpable, especially in athletic. It is very visible. You do not need to palpate; it is already visible. Untuk orang-orang yang suka berlari, suka berlari laju, apa yang suka atletik lah ya, macam contoh atlet naik basikal, atlet berjalan kaki dan berlari ya, dia punya betis kat belakang tu ada bentuk cantik. Kan? Bentuk cantik itu adalah disebabkan oleh the muscle fiber that belongs to gastrocnemius muscle. Okay, gastrocnemius muscle. So kalau you nak contract the gastrocnemius muscle, you should plantar flex you punya foot and then you can palpate, okay, the gastrocnemius. Underneath gastrocnemius, ya, di bawah gastrocnemius ada dua lagi muscle iaitu soleus, ya, soleus dan juga plantaris. Okay. Soleus dan plantaris are not palpable and they are not visible. Okay, the only palpable and visible muscle in the posterior compartment of the leg is gastrocnemius, provided you are athletic enough. Okay, right. These three muscles are considered as the superficial posterior compartment muscle of the leg. Okay, and their main function is to do plantar flexion. Plantar flexion. The gastrocnemius muscle and the soleus muscle both will insert ataupun the point of insertion is at the calcaneum. Calcaneum, okay, right? The plantaris is also will insert at the calcaneum. However, plantaris is a very small muscle that contributes very minimal to plantar flexion. The primary mover of plantar flexion is of course gastrocnemius and also soleus. Okay, gastrocnemius and also soleus. If you look at the origin of gastrocnemius has two heads like that, and they originate from the lateral and also medial condyle of the femur at the posterior side. Okay, near the intercondylar fossa, okay, just above the condyle of medial and lateral condyle of femur, okay, at the posterior side, while the soleus muscle originates from the lateral condyle of tibia, lateral epicondyle of tibia, okay. Right, the deep group. Now let's take a look at the deep group of posterior compartment in leg muscle. Okay. The deep group ni banyak sikit and it's a little bit confusing. The tendon tu ada berbelit-belit sedikit. So the tendon in the deep group tu dia pusing dan berpintal menyebabkan kita a little bit confused masa kita nak identify the muscle. But it's okay, take your time and do this. Draw the posterior part of the tibia fibula bone and then try to color the origin and insertion of the respective muscles in the deep group of posterior compartment in the leg muscles. Okay. Now, kita tengok yang senang dulu, popliteus. Popliteus, okay. Popliteus ni is also macam plantaris juga. Dia very short and very tiny muscles at the posterior part of the leg. Okay, and it helps in knee flexion a little bit, but not much of a function. It's like ini adalah beberapa muscle yang kita dapati kalau dia tak ada pun the function still remains. The function in the human body will still remain. Okay, ini antara muscle yang beberapa population, ada beberapa percentage of the population dah tak ada. Okay, it originates from the lateral epicondyle of the femur and it ends at the medial border of the shaft of tibia. Okay, now kita tengok yang seterusnya iaitu flexor hallucis longus and flexor digitorum longus. Okay, flexor hallucis longus originate from the lateral surface of the fibula, lateral surface of the fibula and interosseous membrane posterior part. Okay, interosseous membrane posterior part. Because the name is flexor hallucis, therefore it must insert at the first digit, big toe, hallux, our hallux. So the tendon of flexor hallucis longus inserts at the distal phalanx of the first digit, big toe. Okay, distal phalanx of first toe, first digit. Okay, the function is to flex the first digit lah. Okay, flex the first digit. The flexor, then we'll take a look at the flexor digitorum longus. Yeah? Flexor digitorum longus. Flexor digitorum longus arises or originates from the posterior shaft of the tibia. Posterior shaft of the tibia. Okay, and of course, because the name is digitorum, so we know already that it inserts the tendon into the distal phalanges of second to fifth digits. Okay, it inserts itself, its tendon at the distal phalanx of second to fifth digits, and the function is to flex the second to fifth toes, okay, or digits in the foot. Right. Now we have the tibialis posterior. Tibialis posterior originates from the posterior side of the interosseous membrane between tibia and fibula. Right. And okay, this is a tricky part. Look at the tendon. The tendon right around the flexor digitorum longus muscle, flexor digitorum longus tendon, and inserts itself at the same area where the tibialis, remember, sorry, the fibularis longus tendon insert, okay, from the lateral compartment. Fibularis longus from the lateral compartment inserts at the base of first metatarsal and medial cuneiform. So does the tendon of tibialis posterior, which inserts at the medial cuneiform. So at the medial cuneiform, there are two tendons of muscles inserted there. Number one is our tibialis posterior, and number two is our fibularis longus. All right, and both the function is to do eversion and eversion. Okay, eversion. All right. Okay, I think that's about it. Okay. The muscles of the leg is slightly confusing, I know. So you go back and read again. Okay, the Natus Clinical Anatomy. Revise again about all these muscles, especially those in the lateral and posterior compartment. The anterior compartment is not that difficult because you see the anterior compartment is very straightforward. It dorsiflex and also extended digits. Okay, and it's very clear the position of each of the what do you call that muscles. Okay, but go back and revise and do this. Draw the bone, tibia, fibula, anterior, posterior view, and draw the skeleton of the foot. Color the origin of muscle and the insertion of the muscle. And take your time to memorize this one because it's going to be quite extensive juga bahagian ni, ya. Right? Thank you very much. See you in the next session.